guidelines, the recommendation is to exclusively breastfeed for the first 6 months. Part of what we know is happening with the breast milk in the first 6 months is that the breast milk actually finishes the development of the intestinal lining by literally coating the intestine through repetitive exposure. And this is why breastfed babies have less allergies, because that finishing of the intestinal lining by all the coating of the breast milk makes it much harder for potential allergens to pass through the intestinal wall and then cause problems. But then by 6 months, our kids are hungry and they need additional food. So this is when we start to give them, the cereals and the vegetables and all that kind of stuff, and applesauce and all that good stuff. What the AAP then recommends is to continue breastfeeding for a minimum of 1 year. So the recommendation is 6 months exclusive, and then in terms of total duration, a minimum of a year. Now, how we then apply that depends on a lot of factors, right? And depending on when you have to go back to work, if you have to go back to work in the first 12 weeks, I would definitely recommend having a breast pump and pumping the milk, because you're still in the newborn time period and we really want you to keep your milk supply up, all right? But if you're going back to work, like let's say 6 months and beyond, you're now already bringing in additional foods. And if it was really challenging to pump, you could then think, okay, well, the formula is like another food, all right? And then between 3 and 6 months is kind of up in the air. I mean, I have to be very honest in terms of, I'm a huge advocate for breastfeeding because it is so incredibly nutritionally superior. And your baby just gets sick less, they have less respiratory infections, they have less diarrhea, they have less constipation, they have less asthma, they have less colds, less flu. It just makes your life so much easier when they get sick less. The reality is sometimes we hate pumping. Pumping, I will tell you, is just a total drag. We pump because we're committed to the idea of leaving breast milk in a bottle. It's really nice to nurse your baby. It's cuddly, they're nursing, you're totally bonding, you feel like you're doing this great thing. And in fact, the good thing about nursing in the early weeks is it's the only moment when you know you're doing the right thing. You're like, I'm feeding this kid this perfect food and I get to sit down. All right, so it's like huge validation in the early weeks. But in terms of how stressful it is to pump at work and how much of a schlep we have, it's really your call. It's really, really your call in terms of when you want to pull in an additional food supplement to work with the nursing. If you do use formula, I would recommend using only the pre-mixed liquid formulas. The powder formulas are not sterile, so they can make babies sick. All right, and nobody knows this. But so you only want to use the liquid, like the pre-mix, even though it's a little more expensive.